Okay, you are recording now?
Yeah.
Okay, so the first to determine your landmark, we have this the right nipple and this is the left nipple here. Okay, so either you will go from the left side or the right side according to the side of the pneumothorax. So first determine the nipple, and we know all of us that the nipple in the fourth intercostal space. So to insert the ICD in the fourth intercostal space, you should insert it on the anterior axillary line. So if this is the axillary line, this is the anterior axillary line. Okay? So this is the anterior axillary line and this is the fourth intercostal space. So this is my site for insertion. So I will go from this side. Suppose I know that I will go from this side now because this is right pneumothorax. Before I will go, I should take, this is the sides I will take incision. I prefer to take a transverse incision. So my transverse incision will be like this, to be with the skin crease. I didn't prefer to take it long, but I prefer to take it on the transverse line. Okay, so it depends. I like, for me, if the patient is stable and is still maintaining its saturation, I will insert. I can take the stitch before insertion. I prefer this, and this is, you'll do it if you are confident and you'll do it rapidly. I prefer to take the stitch before insertion of the ICD. So I prefer figure of 8. So I will go from this side. Suppose this is the first here. This is the first. I will go from one side and I will go out from the other side. But this is the first one. Let me cut here. Okay. So from there I enter. Remember, I enter from this side and I go out from this side. Again, I will go from this side here. And I go out from the other side. I didn't remove it. Okay. So now I have the what is called figure of 8. Imagine this is the one. If I start to wrap it like this, it will be figure of 8. So I will leave it like this. I will not take any, but I know that I will go here now. Okay. Before insertion, before I take the incision and I make some opening. I didn't like to open the muscle wall and the pleural. This is not my technique. I only open the muscle, but I didn't open the pleural. So I am measuring by my eye. We know that everything is trial initially. So suppose this, the direction should be up to the apex of the line. So if I will go from here, so this will be for me very acceptable. This will be very nice. So I am holding the tube from this like this. So I am holding the tube like this. So we measure like this. So I am holding the tube like this. So if even I pass, I will never, the end will be here. So we need to make a support from the other side. Then you will go like this. Then you will press. Then once you will pass, I'm going to the direction here, and I will never hold it from here or hold it from here, because if I hold it from here, I will go deep definitely. So whatever I measure, I am holding the tube like this. So I make support from the other side and I go from the side of insertion and little pressure. Then I will find that I am in the space. After I be in the space, I will remove the trocar. Then I will take, imagine this is inside, then I will take my figure of 8 suture. This is the one. So see, it will be like this. So now I close the skin already over the ICD inside. So this is the figure of 8. So I will take another stitch or whatever. So then I will wrap it over that. Already I take the stitch here, but figure of 8. So it will be very strong and will not be go out. After insertion, very important, طبعا we'll remove the trocar and we'll connect to the underwater seal, whatever. So after insertion, you should do something else. Always, because sometimes the patient is edematous, sometimes the patient is septic, sometimes you are junior, you don't know that maybe you pass subcutaneous. After insertion, always don't forget to palpate the chest tube on the chest, because sometimes you will go subcutaneously. So if you are not something now, you are okay, you can see the underwater seal bubbling, or you can see oscillation of the chest tube. Also another point, if you didn't see oscillation, and you are sure that you inserted in the right way, don't be panicked and think that this ICD is out. Sometimes the only amount of air will fill the ICD and the tubes till the bottle. So don't be panic. Sometimes will not see oscillation, but if you are in, and after that you will see the saturation improved or patient breathing improved, and you will do X-ray. You will check the position. Everything will be okay. Don't worry. Sometimes the collection will be there. So you should make two things. Attached to negative pressure, you can start from 10 centimeter water or 15 centimeter water. Sometimes, if you did the X-ray and the ICD position is okay, sometimes you need to, this hole, you can see the hole. Sometimes the pleura coming over the hole, so air will not come. So you need to rotate it like left or rotate it to right to make the hole away from the pleura. So will not be attached to anything. Just the rotation, and will be okay. The second also, the tip also, some advising before insertion also to rotate the patient to the left side to make the air up, so it will be easy for you. After insertion also, if you see the pocket of air still down, you should make your patient at least 45 degree, so also the air will be up and the ICD can drain all the air. And thank you for your attention.